Well, thank you for the opportunity to talk on this panel and particularly around public-private partnerships. I'm going to take a bit of a different perspective, probably more like the morning session on cities and climate change, because I think that we've just recently published a paper, which I'll share with you, on the interaction of obesity, undernutrition, and climate change, and I think it has a particularly dramatic effect on urban settings. And particularly the focus of today's talk is going to be on obesity. The whole issue of climate change, as you undoubtedly know, is a particular issue in low and middle income countries, which are really the victims of climate change, fostered by the middle income and upper income countries. So in February, we published this paper on the global syndemic of obesity, undernutrition, and climate change. The term syndemic is new to medicine but old to anthropology, and the way to think about it is that it's a synergy of epidemics. And we considered climate change as a pandemic because of the breadth of its effect and its effects on health. A pandemic is the interaction of two or more pandemics, in this case, obesity, undernutrition, and climate change, which interact with each other in time and place and negatively affect each other. And they have common economic, societal, and environmental drivers. These are driven by food, transport, and urban design and land use systems, and I'm going to focus more on the agricultural system today, and the focus is on population rather than individuals. This perspective is important because it offers opportunities for double and triple duty solutions. And we talk in the paper about policy inertia, the resistance, largely from industry to policy changes which improve obesity in both here in this country and in the developing world. To give you a sense of how this operates, so increased greenhouse gases produced largely by the agricultural system, which is responsible for 23% of greenhouse gas emissions, increases temperature, increases the variability of rainfall and extreme weather, particularly in low and middle income countries, although we're seeing the same thing here in the Midwest. This alters crop yields, it reduces the nutrient content of foods and causes price increases, and that alters nutritional status. So if you think about the marginal status of nutritional production in low and middle income countries, these are particularly going to be affected and increasingly reliant on imported food, largely in urban centers for their sustenance. Increased greenhouse gases also has an effect on fish content and alter nutrient content through its effect on ocean temperature and ocean acidification. Now, the trends are this. The upper red bar in this shows the increases in the prevalence of obesity over this 30-year period. And on the bottom, you see a gradual decline, not as marked as the increase in obesity, in undernutrition. This world increase in prevalence has left no country unaffected. All countries are experiencing an increase in obesity, and nowhere is there a downturn. And it's hard to postulate. It's easy to postulate, but it's hard to prove what's driving these changes. In my view, one of the most important things is the advent of supermarkets and the alterations in the food supply which this provides, particularly increased consumption and availability of ultra-processed foods, and I'll show you what those are in a moment. These are also heavily marketed foods, which plays a role, and industry in the developing world is even more aggressive about marketing food than it is in the United States. And finally, I think there's a case to be made for reduced physical activity, but it is harder to prove and harder to change insofar as it depends on changes in community infrastructure, which I gather you have spoken about this morning. So this is how the agricultural system and food processing contributes to the global syndemic. As I mentioned, the major source of greenhouse gases is agriculture, beef production, and dairy. But I'm going to focus this morning or this afternoon on the effect of ultra-processed foods. Ultra-processed foods, particularly corn production, has a major effect on adverse effects on the environment. It's heavily fertilizer dependent. heavily pesticide dependent. About 30% of the production of corn goes for ethanol, 30% goes for cattle fodder, so it feeds the upper part of this curve. A good example of the environmental consequences of this process, the agricultural process, particularly corn production, is on the flooding that's occurring in the Midwest that's leading to an increase in the dead zone in the Gulf that's the size of New Jersey, according to the New York Times yesterday. This ultra-processed foods, as I'll show you, are also very convenient. They're widely distributed, as I'll show you. And what's not to like about them? They're high in salt, sugar, and fat. They're inexpensive, and they last forever on a shelf. So they're very appealing in low-income communities which don't have the access that they might to fruits and vegetables. The interaction of beef and dairy productions and ultra-processed foods leads to obesity, diabetes, cardiovascular disease, and cancer. So that is one of a good example of the interaction across climate change, agriculture, and human disease. Now, I think, as you know better than I think, that the trends globally have been toward increasing globalization. And that's been accompanied by both increasing fast food sales as wealth has increased. And this curve on the abscissa shows increasing wealth, and on the ordinate shows increasing fast food sales. So you can see that as countries increase their wealth, they increase their fast food consumption. And that's enhanced by marketing. These are two pictures from the New York Times Planet Fat series. And you can see in the bottom what Nestle does, which is going door to door at the time when people in Brazil receive benefits, selling food. And the foods, although Nestle produces some healthful products, the foods that are consumed and purchased are not so healthy. They're generally ultra-processed foods, just like those in the mini market that you see above. So what are these ultra-processed foods? Well, this is the NOVA classification of food. NOVA is a term that Carlos Monteiro in Brazil developed. It is not an acronym for anything. And you can see the first three groups are really minimally unprocessed or minimally processed foods, whereas group 4 are ultra-processed foods that are made from industrial substances with little or no whole foods. These include sugary drinks, packaged soups, noodles or snacks or cookies. So coming back to the corn example, the other application of the high fructose corn syrup that's produced from corn goes into sugary drinks. And there are good data that show that not only are sugary drinks associated with obesity, but the reduction in sugary drinks is associated with weight loss. So again, we have a connection, this interaction of terms. Now, there are several areas of support for the effects of ultra-processed foods on the pandemic, and I'll share these with you as we go through them. There's been a recently published randomized clinical trial of ultra-processed foods versus unprocessed foods. It's consistent with food patterns related to weight gain and loss that come from the Nurses' Health Study and the Health Professional Study. It's consistent with what we know about satiety, and it helps explain the disparities related to obesity, consistent with the evolution of the pandemic. So here's the randomized clinical trial. This was published several weeks ago by Kevin Hall, who's at NIH. In the upper blue graph to the left are 14 days of 10 people consuming ultra-processed foods. 20 people. It was a crossover. And 20 people consuming unprocessed foods. And during the period of consumption of ultra-processed foods, people consumed 500 calories a day more than they did on the unprocessed food, even though these foods were matched for the percentage of protein, fat, and sugar. The volume was quite different. And over that same period, as the right slide shows, people on the ultra-processed food diet gained 2 pounds over this 14-day period, whereas people on the unprocessed food diet lost 2 pounds. This is consistent with the left figure, which is an abbreviation of the data that were published from the Nurses' Health Study and the Health Professional Study, which showed the foods associated with weight gain over a 12 to 20-year period. And you can see those green bars in the upper part of this slide are the processed foods, unprocessed meats, sugary drinks, French fries, potato chips, refined grains, whereas those foods associated with weight loss were unprocessed foods like whole grains, vegetables, and fruit. We also know that unprocessed foods are associated with increased satiety, that satiety is regulated by volume, so that low energy density foods like fruits and vegetables, consistent with unprocessed foods, are more filling and displace the increased caloric content of the more processed foods. Protein is also an essential determinant of satiety, low-fat sources of unprocessed meat, poultry, and fish, and fiber that's found in whole grains and fruits and vegetables. It's consistent with the history of evolution. This is a slide that shows the food consumed over the course of a year by a family of 4 in 1951. And you can see that, you may not be able to see, but I can point out to you that the only processed foods in this slide are the cornflakes up in the upper left-hand corner. Everything else was unprocessed foods. And we have now 3 studies which show that the changes in ultra-processed foods marketing and consumption in this case in 12 Latin American countries is consistent with weight gain over that same period. This is a change in mean BMI versus change in per capita consumption of ultra-processed foods. These data, the same study has been replicated in Europe, and there is now another study that shows that 80 countries, high middle income and lower middle income countries, have the same pattern, that ultra-processed food consumption rises with or I should say BMI rises with the availability of ultra-processed foods. To bring this back, increasingly, this is an urban phenomenon. The supermarkets that were introduced began in about 20 years ago, coincident with the rise in ultra-processed foods, and those were concentrated in urban centers, although they've now spread to rural areas. And interestingly enough, the prevalence of obesity in urban centers is higher than that in rural areas, although there's a paper that's going to be forthcoming in July that shows that rural areas are catching up and often exceeding the prevalence of obesity in urban centers. The reasons for that are not clear. So to just turn briefly to solutions. So if we're able to reduce the consumption of ultra-processed foods, either by redirecting subsidies so that, for example, corn, we're actually paying the true costs of production of ultra-processed foods, that may make them more expensive and the ultra-processed foods more expensive and less consumed. Marketing restrictions are a possibility. Those have been violently resisted in countries like Colombia and Mexico, which was able to pass a sugary drink tax, was also in the face of a very substantial industry resistance. Nonetheless, that's beginning to happen. And another strategy would be to implement food labels that indicate the sustainability of the food supply. The triple duty action, the triple duty consequences of this approach would be to provide healthier diets for obesity prevention, more land for sustainable agriculture, lower greenhouse gases from agriculture and transport, and from ultra-processed foods. I just want to deal briefly with the contribution of urban design, land use, and transport systems. So that you see here that transport and urbanization decrease physical activity, increase obesity, and the transport and urban systems contribute to climate change. This also has an effect on the food supply insofar as it provides access or limits access to markets and to food supply. And there is a triple duty solution for transport by changing the modal forms of transport in redesigning infrastructure to support physical and public transport systems, reducing subsidies for fossil fuels, increase the gas tax, and social marketing. But in many respects, our ability to change the food supply is somewhat easier because there are more alternatives available, and it's a more immediate impact, in contrast to the kinds of changes that are needed in terms of redesigning infrastructure for modal shifts in transport. So I hope I've given you an overview of a global context of obesity and potentially the major factor, or one of the major factors that may be contributing to increasing the prevalence of obesity, particularly in urban centers and through the consumption of ultra-processed foods. Thank you.